I'm talking with Levi Singh, Strategic Advisor on Youth, SRHR Africa Trust, South Africa. Good afternoon, Mr. Levi. You represent the young people affected by the AIDS epidemic in South Africa. What are the major problems that the youth face in regards with the HIV response services and sexual education?
Thank you for the question. In South Africa, I think the biggest underlining driver of HIV, especially when it comes to adolescents and young people, is a unique conundrum of gender inequalities and poverty, and those intersecting. If you have to look at the South African reality, currently 2,000 new infections occur every week amongst adolescent girls and women between the ages of 15 to 24 years old. So you can obviously see the gendered dynamics of the epidemic. And this primarily comes down to the fact that there is very little gender equality in society. Women haven't necessarily gained as much power as they should need to manage their autonomy and access their best health outcomes. And in terms of the structural infrastructure, I mean, it's great that we have very progressive laws and policies that should enable citizens to achieve their best health outcomes and to stay HIV AIDS free. But there's very little, I'd say, sincere will to resource certain agendas that would give people power to determine their collective futures, and that's something that does need to change. When it comes to comprehensive sexuality education, or sex ed, we've started an aggressive process to reform the curricula that is administrated in the public school system, looking at how we can ensure that the comprehensive sexuality education curricula is holistic, it's inclusive, and in all sense of the word, comprehensive. So it will cover everything from bodily autonomy, it will cover anatomy, it will also cover things like healthier relationships, because young people need to know how to transact relations and how to be comfortable with feelings and emotions, but then also healthy communication, etc., etc. But then also looking at issues that we wouldn't necessarily connect to CSE around sexual orientation, gender identity, and ensuring that, you know, we respect difference, we create a culture of acceptance and tolerance, and yeah, that's basically where we're at currently.
So your organization, and maybe you personally, how do you help people in solving these issues, these problems? And from your point of view, the experience that you have, how may it be useful in our region, Eastern Europe and Central Asia?
What we tend to do is we tend to focus specifically on advocacy. So we're very aware that there's an overwhelming amount of agreements at a political level that should be there to enable people to access their best health outcomes, especially when it comes to sexual reproductive and health rights. However, there's a very big disconnect in terms of what is up here at political level and what's practical on the ground. So what we do is we do a lot of awareness raising, and we do a lot of building of capacity of young leaders, specifically when it comes to them being aware of their rights, and then nurturing confidence amongst these young leaders to connect with other young leaders, to start pushing for policy change, to start looking at how they can enact accountability mechanisms to ensure that even if there are policies in place, that young people are owning the process of making sure that what those policies say are actually being implemented, and that we can then start leading, not as, you know, looked at as passive beneficiaries, but leading as partners, and not just the leaders of the future, but leading as equal citizens and equal partners in the collective future that we're trying to create. So That's basically what we do, advocacy. In terms of practicality within the region, it was quite funny. I was having this conversation with Yana earlier on in terms of how we should look at fostering some sense of South-South collaboration. I think that a lot of previous development initiatives in the past have been north to south, and there's some sense of arrogance that there's nothing that the north can learn from us in the south. And I think that we need to start strengthening, South-South relations, and we need to start sharing best practices. And especially as young people, we need to build some sense of common cause and global solidarity when it comes to these specific health issues. Because if we have to look at our realities, whether you're from Russia, or whether you're from South Africa, or whether you're from Belarus, young people are still the most left behind population when it comes to political, social and economic representation. And that comes at a time when we are currently the world's largest generation of young people in human history. There's 1.8 billion of us globally, but we're practically invisible. So it's about reclaiming our space, reclaiming our power, and creating some sense of global solidarity amongst young people. That's what we can do together.
So if you could talk to the young people from the region of Eastern Europe and Central Asia, what would your message be?
What would my message be? I usually like to refer to Mark Twain, who once said that the reasonable person adapts himself to the world. The unreasonable person adapts the world to himself. Therefore, all progress, or all human progress, is based on the unreasonable man, on the unreasonable person. I would encourage young colleagues from this region to be unreasonable about a status quo that doesn't care about them, to be unreasonable about a global status quo that wants to exclude them, and to be unreasonable about their role in upsetting the status quo and in dreaming about a better world and actively working towards creating that world together. That's what I would say.